Bismillahirrahmanirrahim. My name is Dr. Adeel Iqbal. I am a consultant in acute medicine at the Medway Maritime Hospital in Kent. I am very grateful you have contacted me about the emergent debate concerning the burials of COVID-19 positive deceased patients. This is a very important debate which has consequences that we should be aware of. I want to begin by thanking you for all the hard work you have put into this process to dignify the dying process as much as possible in this difficult time, and I also pay tribute to my NHS colleagues who are working tirelessly to save lives day and night. To gain an insight into this debate, I have had an extensive discussion with one of the UK's most eminent histopathologists, Professor Ian Roberts, who is a professor of cellular pathology at the Oxford University Hospitals, and we have discussed the pathophysiology of COVID-19. Professor Roberts advises that the novel coronavirus aggregates in nasal secretions as well as oropharyngeal secretions, and post-death, at the time of preparing the body for ritualistic washing and shrouding, these secretions can come into contact with the person or people who are performing this ritual and can contaminate and infect those individuals. Moreover, COVID-19 can contaminate the surface and surfaces on which the body is being prepared, whether that is in the place of worship or whether that is the funeral director's apparatus, and that can act as a subsequent hazardous risk. I would also mention that the body bags in which COVID-19 positive deceased patients are placed in are sealed bags, which really should only be opened for the purposes of identification. Even then, PPE, personal protective equipment, must be worn. That includes gloves, a gown, apron, a face mask and a visor at the bare minimum. And if a person or a team is going to prepare a body ritualistically for washing and shrouding, then industrial strength PPE is required. That includes an FFP3 rated face mask, a visor, goggles, an apron, gloves and a gown at the bare minimum. Of course, we know that there is a shortage of these supplies, and if they are available, these should be prioritised for frontline healthcare workers so that they can continue to treat the thousands of people being infected on a daily basis. In summary, Professor Ian Roberts categorically states that he advises against the ritualistic washing and shrouding of these patients, and advises that they should be buried directly in the body bags from the hospital setting in conjunction and accordance with the national guidelines. I hope that you will consider this information. I appreciate this has far-reaching consequences and of course has implications for the religious component of death, and I pray that Allah subhanahu wa ta'ala accepts these efforts, and I pray that the information which I bring to you, which is in conjunction with the authorities of the time at the most respected global institutions, is of use to you. And I pray to Allah subhanahu wa ta'ala that if there are any mistakes, that He forgives me in dunya and akhirah, and I hope that we continue our struggle together to cross this pandemic and to minimize the risk to our public. Thank you very much.